Thank you very much. Hi, as she said, my name is Amy Arnold, and I work for the Central Plains Area Agency on Aging. I'm going to refer to it as CPAAA because it's easier. What I wanted to talk to you about is making the most of your Medicare online tools. So she said I was a SHIT counselor, which is correct, and that stands for Senior Health Insurance Counseling for Kansas. It is free, confidential, and unbiased counseling, meaning none of us have any buy-in to any type of insurance or agency or any particular type of Medicare insurance. We do counseling for those who are new to Medicare. We do answer questions about general Medicare. We help with open enrollment, which we'll talk about later, but it's October 15th through December 7th. That is the time frame that Medicare gives all their beneficiaries to renew their Part D drug plan. And so we help people with that. And then we can also help see if you qualify for extra help, which is help paying your drug plan premiums and costs at the pharmacy, or if you qualify for savings plan, which is help paying for your Part B premiums. So in the Harvey, Butler, and Sedgwick County areas, which is what CPAAA works with, you can call our hotline number, which is 855-200-2372. And we just ask for a Medicare counselor, and we'd be happy to help you with any specific questions you have. If you know somebody that maybe doesn't live in those counties that does need SHIT help, they're all over Kansas, and that number is 1-800-860-5260. And we're always here to help you. So what I'm going to talk to you about today is Medicare.gov. Now, I want you guys to be careful because there is a site out there called Medicare.com that a lot of people think is the official Medicare site. It is not. So just remember that it's a government program. It's a government insurance. Therefore, it's going to be .gov at the end of the website. So Medicare.gov. Now, I'm going to walk you through how to create an account. Since I cannot do that live, I have taken screenshots. And then once we go over all the things that you can do in your account, I'll go out to the actual website and help you guys look around there. But for right now, we're going to look at the screenshots. So this is the front page for Medicare.gov. And as you can see, it says log in, create an account. You would click that, and it will take you to the login page. So after you create your account, this is the screen that you will see. You'll just type in the username and password that you created. The first time you want to create an account, you'll go over to this Create an Account Now. Creating an account is super easy. You just need your basic information plus your Medicare number. So if you have not yet turned 65, or if you are not yet on Medicare, then you can look at all the great things that the regular Medicare.gov site has, but you can't create an account until you have that Medicare number. So a lot of people ask about the new Medicare numbers. They used to be your Social Security number. They finally decided that wasn't a very good idea, and they changed it. So if you still have a red, white, and blue card that has your Social Security number on it, you should have gotten a new red, white, and blue card with a Medicare number that has both numbers and letters. If that is not the case, then you can request one. You just need to call Social Security, and they'll send you a copy of your new card. So to create an account, you need your Medicare number, which is, again, this long number that has letters and numbers in it, last name, and your email address. You don't have to have an email address. I know a lot of people don't, and that's okay. The reason why they want your email address is if you get kicked out of the system, if you forget your password and get logged out, it's just an easy password retrieval. But if you don't have one, no worries. Just click the little I don't have an email address and move on. They're going to ask for your date of birth, and this page is quite long, so I had to put it on 2 different slides. It'll ask for your zip code next, and then it'll ask for your Part A coverage start date. Go back one. That is going to be on your red, white, and blue card. It'll say Hospital Part A and the coverage start date. That is what they want. Then you do have to agree to some terms, of course, because it is a government website. So you have to say, by clicking this box, you certify that the information listed above is true and complete to the best of your knowledge. And then the second box talks about the online services and web confidentiality agreements. Please read it. But to sum up, it just says basically, this is a government website. Do not commit fraud on it. That's it. All right, so then you would click next, and I don't have a picture of this next slide because I obviously couldn't make a real one, but basically the next step is how you create your username and password, and honestly, this is the hardest step of the entire thing. But if you follow the rules that they give you, it's easy enough. You have to create a username, and it does have to have both numbers and letters. Most people just use a combination of first and last name and birth date, or first and last name, the year that their Medicare started. The username isn't as important as the password. So you want to make your password a lot harder than you make your username. And there are also rules for how to make your password. And they are listed on the right side of the website, so you just have to pay attention to it. So it requires uppercase, lowercase, numbers, and then certain special symbols. You can't just use any. They have like 5 or 6 they give you the choice of. Once you pick that, then you're good to go. Then it'll take you back to the screen that I showed you earlier that said log in. And once you log in with your new username and password, it'll take you to this site every time. So this is the home page for somebody's account. So I have taken out, it is a live shot. So I have taken out their identifying information. So some of the stuff you're going to see things covered up, and that's why, it's because I actually use somebody's real account with their permission. So on your front page, you'll see your current plan if you already have a plan. This person has Humana Walmart Value Plan, RX. The RX is your prescription plan. It has when their coverage start dates, Part A and Part B. It does have unread messages from time to time. Usually the first time you get in there, it'll be nothing, but then the next time you log in, it'll be like welcome messages and stuff like that. You can print out a new Medicare card, and there are several places on the website that you can do that. So if you have misplaced yours or lose it, it is easy to print a new one if you get one online. You can get your Medicare summary notices electronically. So if you have a hard time getting your mail, or if you just want to, save the environment, you can get them electronically. And then we are going to do the View My Plans. So if you click the View My Plans, then it will take you to all the plans that you have that are connected to Medicare. So this person has original Medicare, and I don't want to go through Medicare basics in detail, but I do want to just go through it real quick. Medicare comes in two different ways. You can have original Medicare, like this person does, which is Part A, the hospital, Part B, the major medical, so your doctors, your labs, things like that. And then they have a prescription drug plan, which is right here. And then under other insurance, they have their supplemental or Medigap. So original Medicare pays 80% for Part B of your major medical. If you, depending on which supplement or Medigap policy you get, it'll pay the other 20%. So all you pay is premiums. You may have some out of pocket depending on which one you pick, but most of them you won't have much out of pocket at all. It'll all be premiums. The other way you can have Medicare is you can have Part A and Part B, but then instead of getting a separate prescription drug plan and a separate Medigap, you can enroll in what's called an Advantage plan. And that is where you still have to pay the Part B premium every month, but there may or may not be an additional premium. Usually there is not. But then instead of them guaranteeing that they're going to pay the 20% that original Medicare doesn't pay, they have you pay co-pays to go to the doctor or go to a specialist, or if you have labs. If you go to the hospital, instead of paying the one deductible, you'll pay per day, that type of thing. So those are the two ways you can go with Medicare, and that'll be all under My Plans. So it also will tell you if you qualify for a special enrollment period. When you first apply for Medicare, you have the 3 months ahead of your birthday month, and the 3 months after your birthday month to enroll in Medicare without penalties. But you can also have other months of the year that you can enroll without penalty. So if you were working and are retiring and are now needing to get on Part B Medicare or Part A Medicare, you can do that during a special enrollment period. If you move out of state or even out of the city and your plan no longer works in your new zip code, then you will qualify for a special enrollment. So there's all kinds of special enrollment periods. And then you can also find and compare other ones if you are able to do that. So going back to the start page, this is the top half of the page, and then you'll go down, you'll scroll down, and it says, what do you want to do? And the first option is view my claims. So in your claims, you can check your deductible amount. You can, again, get your Medicare summary notices electronically. That would require an email address. You can filter the different types of claims, or you can just do a date range. If you know the claim number that you're wanting to look up, which is rare, but some people know it. You can look that. And then, like I said, this is a real live person, so I did block out the provider, but this would just be the doctor's name, and then the date of the service. Now you'll see over here, the Medicare approved amount was $86.56. Original Medicare, which is what this person has, pays 20% of that, so that's $69.84. Then it says you may be billed $17.31. If you do not have a Medicare, a Medigap plan, a supplement plan, you would be responsible for that $17.31. But since this person has one, then they are not responsible for that $17.31. Their additional insurance will pick it up. Going back to the first slide or first page, you can pay your premium. Now, not everyone can pay their premium online. Most people pay it through their Social Security. So if you're already getting Social Security when you get Medicare, then you can, it'll just be automatically deducted every month from your Social Security check before they even put it in your bank or send you a check in the mail. Also, if you are on railroad retirement, same thing. There are two other ways to pay your Social Security. If you want to pay it monthly, Social Security does require you to take your Medicare premium out of a bank account, and they do that automatically. If you do not want them to take your Medicare Part B premium out of your bank account, you have the option, and this is where the Pay My Premium comes in. You have the option of prepaying per quarter. So you would pay 4 months ahead of time. All right, and then you have Manage My Account, which we'll go into. And if you have any questions, please go ahead and put them in the chat, and I will absolutely answer anything at the end, I promise. So you go into account settings. You see you can change your email address. You can get your Medicare and You handbook electronically. You can set up Medicare emails to come through that way. It also has another section for print my Medicare card, pay my premiums again. Now this one is really nice. This is Manage My Representative. So Medicare will not let me talk to them about anybody's account unless they are on the phone with me and they provide certain information, because I am not a representative. I am a counselor. I do not have any authority to get into their account without their permission. So, for example, my dad is 81 and he has dementia. And so I am his financial DPOA and my sister is his health DPOA. We have put ourselves in the as representatives so that if something happens, we don't have to get him all confused on the phone about the fact that we're calling Medicare and get him upset. We can just do it ourselves since he has put us as representatives. And I mean, that's just a good idea no matter what your health, simply because you never know when something happens. Maybe you get into the hospital and you just don't want to have to deal with that while you're recovering from something. So it would be a good idea to put a spouse on as your representative, or a loved one, or a trusted. It has to be somebody you trust, obviously, but as a trusted person. You can change your username and password. You can connect to apps. I don't have a lot of experience with this, but you can do that. And then you can check the history. So the next three is update and print my drug list. And when we go out to the actual Medicare site, I will show you how to do that. You can, again, they give you lots of ways to print your Medicare card on this one. And then the last one is find providers, which is very important. So Medicare pays a certain amount, and doctors have to agree to accept assignment is what it's called. So they accept that Medicare is only going to pay them this amount, and that's fine with them. If they are not, if your doctor is not okay with the Medicare amount, Medicare allows them to bill Medicare for the Medicare amount and then allows them to bill the beneficiary, you, 15% more than what Medicare says they'll pay. But you're not paying the 15% more. Remember, if you don't have a Medigap, you are paying the 20% that Medicare doesn't pay, plus the additional 15%. So whenever possible, it is good to get a doctor that takes Medicare assignments. There is one caveat on that. For example, if you have a Plan G, a Plan C, or a Plan F, which are the Medigap plans, you do not have to pay the extra because that is covered by the premium that you pay. Now I probably thoroughly confused you. Let's go and look and see what type of providers you can look up. You will put in your location and you can look up these different types of facilities: doctors and clinicians, hospitals, nursing homes, home health services, hospice care, inpatient rehab facilitation, facilities, long-term care hospitals, and dialysis facilities. And then if you click on these, it'll just tell you more about them. So if you have a certain kind, like you know your doctor's last name, or you know you want to go to see a doctor in a certain facility, you can type that in the keyword as well and see if it'll come up and tell you whether they take Medicare or not. So back to the home page, we'll talk about these 3 tabs up at the top. Under Basics, there's information that you can get. You can read about getting started with Medicare. You can read about what the costs are with Medicare, the premiums and the deductibles. You can read about your Medicare rights, which everyone should know. And then you can read about identity theft and fraud. Now, it is important. They keep talking about these Medicare summary notices. It is important for you to be reading those because that's how people catch fraud. Now, there is a certain statistic, a certain fraction of the fraud that is accidental fraud, meaning they coded it wrong. However, it is still within your best interest to make sure that they code it right. You are being billed for what you received. So I do encourage you to look at your Medicare summary notices and then check out the identity theft and fraud part. There's also different resources for you, so phone numbers and website information. There's forms. There's, again, the Medicare New Handbook, and then there's information on advanced directives and long-term care. Medicare does not cover long-term care, so it'll cover short-term stays up to a point in a skilled nursing facility, but it doesn't cover long-term. So that is important to read that information. The next one is health and drug plans. So let's see, you can find your health and drug plans, which I'll show you in a little bit. You can compare coverage options, find Medicare supplement insurance and Medigap insurance. You can learn about getting started with health and drug plans, what the different health plans cover, and how the plans work with other coverage. So if you're employed, how Medicare pays secondary to your insurance. If you are in the military, how it works with TRICARE, or if you're a veteran, how that works. And then your Part D drug coverage. Lastly is providers and service. Again, it just gives you an option to find care, find where you can get Medicare medical equipment and supplies. The Part B drug, major medical does cover some durable medical equipment. So things like it'll cover portions of things like lift chairs and wheelchairs. You do have to get it from a certain Medicare supplier most of the times. And then also your diabetic strips, things like that come out of your Part B. So that if you have any of that issues, you might go ahead and look at the Find Medical Equipment and Suppliers. And then compare procedure costs. And then you can learn what Medicare covers, and then claims and appeals. You can appeal if Medicare says they will not pay something. There are several levels of appeals, and so just because your appeal gets turned over, denied once, doesn't mean you can't keep trying. So there is that information there as well. So why would you want to make an account? First of all, security. A lot of people come to me and they say they are concerned about making an online account because they don't want their information out there. The information is already on the website. And if you create an account first, then you are stopping somebody else who gets your Medicare number and information from creating that account for you. So it's important for you to go ahead and create one. And just keep your username and password in a secure location if you don't think you can remember it. It's a source of fast information, like the claims and stuff. Sometimes it's hard to remember where you put those Medicare summary notices, or perhaps you look at it through a way and then something comes up and you want to look at it again. You can do that online. It is paperless, which environmentally friendly. And then you can review your plans every year, which I'm going to talk a little bit about open enrollment now. So as I said earlier, every fall from October 15th through December 7th, Medicare allows its beneficiaries to look at their current plan, review the medications that they're taking, and then look for a new plan for the next year. Even if you are in love with your plan, it doesn't hurt to look and see what else is out there, because plans change every year. Premiums go up or down. The cost of the medication when you pick it up could go up and down. When you put your information in Medicare.gov, it is the easiest way to see which plan is cheapest for you. And again, we'll go through that in a little bit. You can also review your Advantage plans. SHIC doesn't help with that as much since there's so many components, but I'll also show you how you can do that. That open enrollment is January 1st through March 31st. All right, so I'm going to stop my screen share for just a second so I can get off my slideshow. And then I am going to share the official Medicare.gov website. There we go. So you see that it looks just like I showed you. Here's the login page. They really want you to go paperless. Here's all the fine plans. You can get updates for news and information. Here's the resources. To look at, since we're talking about open enrollment and drug plans, I'm just going to go ahead and start with that. So to look for a new plan, you would just go down to find your plans. If you're logged in, it'll be just down below. It'll say find new plans. So I'm going to go in without logging in since I don't have an active account. And it says it's going to ask you a few different questions. It does say you have to have Medicare before you can enroll in a Medicare Advantage plan or a drug plan, which is correct. So you can choose, I want to learn more about Medicare options before I see plans. So that'll tell you about Part A, Part B, Medigap, Part D, and the drug plans. That'll explain it really well. But we're going to look at just the drug plans for right now. And it's going to ask for my zip code. I'm just going to put a generic one in. Now, if your zip code resides in two different counties, like I believe Mulvane is split like right down the middle between Sedgwick and Sumner, it'll give you the option to choose which county you're in. And then it says, do you get help with your costs from any of these programs? So it asks if you get help from Medicaid, which in the state of Kansas is called CanCare, SSI, Social Security Income, a Medicare Savings Program, which again we talked about you can apply for if you make under a certain amount and have under a certain amount of assets. If you'd like to know more, you may call me privately and we can discuss that. Extra help from Social Security is extra help with your drug premiums or drug costs. Medicare Savings is for the Part B. I'm not sure. And if you click I'm not sure, it's going to tell you to log in. Because they're like, we know, you just have to log in. So it'll also tell you when you log in, if you, it won't ask you all this because it'll already know. And then, so I'm going to No? Okay. So I'm going to say I don't get help from any of these programs. We'll just go generic. And then do you want to see your drug costs when you compare the plans? Absolutely. You always want to see the drug costs because you're going to pay a premium every month for your drug costs, but then you're also going to pay most likely something at the pharmacy when you pick them up. All right, so how do you normally fill your prescriptions? There's retail pharmacies. Retail pharmacies are Dillon's, Walmart, CVS, all of those good ones. And then the little mom and pop ones like Heartland. I totally forgot another one, but there's a lot of them in Wichita and the surrounding areas. Or you could do mail order or both. Keeping it simple, we're going to go retail pharmacy. So I'm just going to put some generic drugs in. As you see, when I'm typing, it's going to auto-populate, which is very helpful. And I can't talk and type, so. All right, so I'm going to do hydrochlorothiazide, which is a diuretic usually used for blood pressure medicine. And it is always best to have the actual pill bottle with you instead of just like a list of your medications, because there's so many nuances in the different medications. It's always good to be able to double check exactly what you have. So you're going to add the drug. You're going to say, I only take 12.5 milligram tablet. But this is what you'll need to know. Do you take a capsule or do you take a tablet? And then I take one a day. So we're going to do 30 in a month, okay? We're going to add another drug. I know Lisinopril is a very popular drug, and I didn't spell it right. So Lisino. Again, always good to have your drugs with you so you know how to spell them. So this is also important. Some of the Lisinoprils, if you see, will have hydrochlorothiazide with it already. So you'll need to know whether your bottle has that or not. We're just going to do the regular since we already entered the other one. Add the drug. Make sure you get which dosage you take. And then let's say I do 10 milligram tablets, but I take 2 a day. So that's going to be 60 in a 30-month period. It's always going to default to a 30-month period. So you're going to times by 30. Okay, add drug. All right, now this next one, we're going to say Wellbutrin. And why I chose this one, it's a depression drug, and it's going to say a generic is available. Only choose the generic if that's what you actually take, because there's going to be a very big difference, most cases, between the price when you go Wellbutrin versus the generic of bupropion. So we're going to add the generic. And we're going to say, I do the 150 tablet extended release 24-hour. And I'm going to take 1 a day. So we're going to add that to my drug list. All right. So here is where you'll see, and if you already have Medicare, you don't actually have to do this. If you just create an account, it'll already be in there. However, sometimes they have really old stuff in there. So, or just like an antibiotic you took once and then, never again. So you do want to edit your drugs or remove the drugs based on whether you still take it, which dosage you take, and the frequency you take. So you can either remove a drug if you say, I don't take that anymore, or you can go in and edit the drug and you can change the dosage and the frequency. So we're going to say we're done adding drugs. And if you don't take any drugs, you would just say done adding drugs from the beginning. You don't have to enter anything. It is recommended that you get a prescription drug plan right off the bat when you enroll in Medicare Part B, because if you eventually get one and you haven't had one, or had a comparable one from your work insurance, Medicare caps on a penalty, which kind of stinks, but that's the way it is. So if you don't take anything, still buy one. It'll just spit out the cheapest policy there is. All right, so we're going to keep the zip code. That's what I stated that I lived in. And I'm going to open this up to 5 miles because you get more choices if you open it up a little bit. You have to scroll down and push apply. Okay. So the way insurances work, including Medicare, is that one plan will contract with the different pharmacies for different rates when you pick up this prescription. It'll have the same premium, but you may pay $5 more at CVS if you pick up a drug than if you went to Gandering or if you went to Walgreens. So unless there is one, which sometimes there is, unless there's one that you absolutely will not go to, we do advise you just look at it. Because that will open up more options for you for cheaper drugs, costs, and overall cheaper premiums. So down here, you see which ones I've completed, Walgreens and CVS. Now you see, I chose Walgreens here on North Woodlawn. I can go to the one on East Central Avenue. As long as it's in with the same, county and same general region, it's all the same. A Walgreens is a Walgreens is a Walgreens. As long as it's, you're not like traveling somewhere. So we're also going to look for just the main ones, Dillon's. This one keeps coming up, is the mom and pop. Oh, I like Aarp Pharmacy because I can pronounce it. And let's see. Is there no Walmart near 67208? Or maybe I missed it. Okay, we're just going to say Forsberg for now, just to show you. I would have picked all 5, though, if I wasn't doing this. So this is going to show you, based on the zip code and based on the 3 drugs that I put in there, what the cheapest plan is for these drugs. So the first one that comes up is Cigna Secure Essential RX. It has a 3.5-star rating. 5 is the best, but 3.5 isn't bad. It has a $24 a month premium, meaning Cigna will bill me $24 a month, or I'll set up automatic bank draft, but I owe them $24 a month basically. The entire year, they're saying for the 3 drugs I get for the entire year and paying the $24 premium, Humana is the next cheapest plan, but it is a Walmart one. So I guarantee you're going to need to pick up your stuff at Walmart in order to get the best prices. It doesn't mean you can't pick them up at Gillings. It just means you're going to pay more. Next one down is AARP Medicare Walgreens. Same thing. They're going to want you to pick it up at Walgreens because they play nicely with the Walgreens on this particular plan. So let's go ahead and go into one of the plan details. Your total monthly cost will be $24. The plan deductible will be $445, which is the maximum deductible allowed by Medicare this year. And it'll say for this drug, this is what you will pay for your drugs at the preferred network one. So let's see, Aarp Pharmacy is preferred in network, Walgreens is preferred, Gillings is preferred, and CVS is standard. So when you go down, we're going to look for that 200 sum. So this isn't going to be the cheapest because this says we're going to pay $378. So we're just going to bypass that. $379. Nope. $218. It looks like Gillings is the winner, but we'll go ahead and scroll down. Yeah. So Gillings is the winner at $218.40 a year.
So it's saying we won't meet our $440 deductible. So we can pretty much ignore these three columns right here. Oops, these three, this column, this column, and this column. We're just going to do the cost before the deductible. So the bupropion, because we chose the generic, we're going to pay $3.30 when we pick it up. We're not going to pay anything for the hydrochlorothiazide or the lisinopril if we pick them up at Dillings. All right. And then it will tell us what the monthly estimated cost for is per month. Now, again, this is when you pick them up at Dillings. You're still going to have that monthly premium of $24 that you're going to pay to the actual insurance company. So that's just kind of a fast and dirty approach to how you look that up. I'm going to go back, and you can do the same thing looking for the plans when you want to look at a Medicare Advantage plan or a Medigap policy. The differences are Medigap Advantage will tell you how much you'll pay out of pocket for the year maximum, and it will tell you what the copays are and everything, and if it has a premium. Medigap policy is a little different. They are contracted with Medicare to provide the Medigap policy, but they don't have like a one-stop shop for where to get your premium costs. So it'll tell you who sells it in that specific region. But you're going to have to call the different insurance agencies and get quotes and estimates. All right, let's go back to Medicare.gov. I'm just going to show you a few other things, and then I'll take your questions in just a minute. So let's see. When we go to, let's see, get started, learn about Medicare. It has a great tip sheet on here. So if you click that little thing, then down here it says already enrolled in Medicare, use this checklist to make the most of your coverage. So it just tells you things, a lot of what I've gone over, but it's in writing and it has the links, which is always helpful. How to create an account, learn how Medicare works with other health insurances. It says it has about what Medicare covers. This is how you get help paying your costs, if you do qualify or how you qualify, review your claims, talks about the open enrollment periods, and then it gives you some good numbers for assistance. The state health insurance system program is like above SHIC, so it's SHIP, and then the specific Kansas is SHIC. So another way to look things up, I'm going to go back, and because I can never remember how to get the preventative exams to show up, I'm going to show you the search engine. It is actually a very helpful search engine. So I'm just going to say preventative plans, and it populates it for me. Yay! So preventative services, we're going to search that. And it only looks within its own website, which is very useful. Sometimes you get a website and for random reasons it does a Google search, which I don't find helpful at all. This one will look just within the Medicare.gov website. So the first one, preventative screening services covered by Medicare. It is important to know that most of these are paid 100%. If not, it'll tell you when you go into it. So let's pick diabetes screenings. It'll tell you what it covers, and it'll say Medicare also covers these screenings if 2 or more of these apply to you. So you do have to, you pay nothing for these tests if your doctor or other qualified healthcare provider accepts assignment. So the doctor has to say you need it, and they have to say that they'll take Medicare's payment. So, but that's what the provider lookup is for. So let's see, what else do I want to talk to you about? We went over how to search for providers. And so your Medicare costs, let's look at, let's see if I can find, let's see, savings plan. Now, when you apply for the savings program, you're actually, or the extra help, you're actually not applying through Medicare. Savings program, which helps pay your Part B premium, is actually through Social Security. And the extra help for the drug plan is through CanCare, the state insurance. So although you can get the information on the website, you will not mail any of the paperwork into Medicare. You'll do it to the actual agencies. So here is the 4 different kinds. It'll tell you the individual monthly income, if you're married, what assets you're allowed, and how much in savings. So, okay, well, I am going to go back to my screen super fast, and we will go down to where I was. There are some find out mores, different information, Medicare.gov. To go directly to the login page, you can go to mymedicare.gov. Oh, they make it really easy on the homepage. CMS does a lot of stuff with Medicare, and there is a website there, as well as KDAGS, which is the Kansas Disability website, Kansas Aging and Disability website. That's where you'll find information about SHIC. So now I'm going to have Savannah read me your chat and questions, and then make sure to jot down the number there. If you have any questions that maybe may take a little bit longer than we can go through in the next 10 minutes, please give us a shout out, and we would be more than happy to answer your questions one-on-one.
Great, thank you, Amy. So I don't see any questions in the chat, but if you have one, please go ahead and type into the chat. Oh, and we've got one. The first question is, do you recommend to wait until you have the Medicare ID and can create an online account before buying a Medigap policy?
You can certainly look around. I'm not aware that they will let you buy a Medigap policy until you actually have that Medicare number, because they have to have it something to connect it to. But it doesn't hurt to look for them ahead of time. Absolutely not. It's just, yes, I would wait until you at least have the Medicare number in hand, if not actually make the account, but actually have the Medicare number in hand before you buy a Medigap policy. Yes.
And you were able to search and look at the Medigap policies without logging in, right?
Yes, absolutely.
Okay,
Yes, you
next
can.
question is, do you recommend to go through an insurance agent to buy Medigap or call the insurance company directly?
It's kind of a preference. Insurance agents want to sell you what they get commission on, but it doesn't mean that they're not going to sell you something good. I like to do my own research, but if that's not your thing, then just do your research on who you're going to go through, the insurance agent. Make sure you find some good recommendations for them, but it doesn't hurt. It doesn't hurt if that's not your thing, but it also is good to do yourself. So sorry, that was kind of a wishy-washy answer.
Great. The next question is, can you buy Medigap before the month you turn 65?
Yes, it just won't start until the month you turn 65, if that is when you said your Medicare is going to start. Your Medigap, if you buy it in time, will start the month that your Medicare Part A and Part B starts. Or Part B if you already have a Part A.
Great. Okay, that's all the questions in the chat. So thank you so much, Amy. I would like to thank you for being here from the Central Plains Area Agency on Aging and
Can
for your presentation. Yeah.
I'm sorry, Savannah, I do actually see one in the chat. It
Oh,
says,
thank
does any plan other than the original Medicare provide dental, vision, or hearing aids? Original Medicare does not have dental, vision, or hearing aids. So if you go with original Medicare, which is Part A, Part B, Part D, and possibly a Medigap plan, you have to also, on the side, purchase a separate vision, dental, hearing, if that is something that you want. Some people just pay out of pocket if something comes up instead of paying a monthly premium. That is up to you. If you get an Advantage plan, then most of them do have some dental and vision and hearing. You want to look at the specifics. If you get an Advantage plan, really make sure what you're buying. It can be very tricky to see everything you're paying out of pocket. So please make sure you know what you're buying when you look at Advantage plans.
Amy, are there resources for someone to do like a one-on-one session to help them enroll?
To help them enroll in Medicare. Right now, our office is closed to the public, but we'll do either a Zoom call or a regular phone call and do everything we can to help you. Usually, I start by sending out a packet in the mail or through email about exactly what you need to do, what your options are, and then I set up a follow-up call to do that. Now, hopefully, people get vaccinated, pandemic slowly goes away, we will open back up to the public. But right now, unfortunately, we're not doing face-to-face.